ago, our local Liberal MLA in New Westminster stood by while St. Mary's Hospital was shut down, closed. Today, what do we see there? A big hole in the ground. Nothing has happened, and we've lost that community care hospital in New Westminster. Gordon Campbell and the Liberals told us at that time that this closure of St. Mary's would not increase the stress on Royal Columbian Hospital. Well, we know now that that is simply not the case. The stress level on Royal Columbian has increased incredibly in that short time. In fact, one day our local fire chief had to come in and clear out the emergency room because of overcrowding. This is just intolerable. If you go into the emergency at Royal Columbian today, you stand an almost 50% chance of waiting around 10 hours, up to 10 hours to see a doctor. And this just is not good enough for the people of New Westminster. At the provincial level, Gordon Campbell and the Liberals, they promised back then that they would create more spaces in hospitals, and in fact BC has fewer long-term care beds now than we did have in 2001. In New Westminster we've lost 111 long-term care beds in this community, and you know what that does to the hospital. It creates a backlog in our acute care facility while people are waiting, taking up an acute care bed because they have no alternatives, waiting for a long-term care bed where they would get the appropriate level of care. I know a lot of people who've come to this hospital and brought family members here, and I've talked to the men and women who work here. They've told me about the effects of the contracting out, of the privatization of food services, privatization of the cleaning services in the hospital, and the deterioration of those services here. In fact, you get more complaints from people who are here in hospital about the food than you do about anything else that happens. I've also heard very troubling accounts about people who are taken off the wait list because their surgery has been booked. Sometimes that surgery is booked for 6 months, 8 months down the road, but they're taken off the wait list, and they might get bumped 3 or 4 times. So the figures that we get from the government on wait times simply are totally inaccurate and in some ways fudged to make them look better than they are. The Liberals are telling us that everything's okay with our hospitals, but you and I know, we all know that this is not the whole story. People who rely on the services here know what the real story is, and we need to re-establish core funding for our hospitals. We need to hire more healthcare workers, that's clear, we all know that. And we have to stop the privatization of our healthcare system. You know, in British Columbia and in Canada, one of the defining characteristics of Canada, and people self-identify this when they're asked what it means to be a Canadian, is the fact that we have a public healthcare system and that people in BC all have equal access to it. We've made a commitment, Carol James and the NDP, to hire 1,000 nurses over 4 years and increase training spaces and expand the co-op placements. We'll deliver wait time guarantees for cancer patients, for cardiac surgery, hip, knee, and cataract procedures so that there are guarantees for the population of British Columbians. That's one of the key reasons that I'm running to be the MLA in New Westminster. You know, it was healthcare that first motivated me to become an activist. When I was a young mom with 3 children under the age of 2, my oldest son, who was only 26 months old, was diagnosed with cancer. And I experienced firsthand, as a young mom with a sick child, how important our healthcare system is to the people of British Columbia. That's been my motivation for getting involved in politics. It continues to be my motivation to run these many years later to be the MLA for New Westminster, to ensure that every family in Canada, in British Columbia, gets the appropriate health care they need, when they need it, and where they need it. On May 12th, please remember to vote for Don Black, NDP in New Westminster. Thank you.